Welcome to this poster presentation entitled Negative Allosteric Modulators of TrkA for the Treatment of Pain. My name is Pontus Forsell and I am Head of Discovery and Research at AlzeCure Pharma. I will start with giving you a short background to the neurotrophin family. Neurotrophins is a family of small proteins where NGF is one out of 4 members. Neurotrophins bind to the TrkA receptor or to the common P75 NTR receptor. NGF binds to the TrkA receptors, and both NGF and TrkA has been demonstrated to be involved in pain signaling. There are several ways to intervene with NGF-TrkA signaling. One mechanism involves the use of anti-NGF antibodies, which has proven clinical efficacy in patients with osteoarthritis, but unfortunately with rapidly progressing OA observed as a serious side effect in a small number of patients. Another mechanism that has been tested is the use of non-selective TrkA inhibitors, here exemplified by TrkA in the figure to the right. These non-selective TrkA inhibitors also display a panel of unwanted side effects, such as CNS side effects and weight gain. We believe that selective inhibition of TrkA by a negative allosteric modulator could be a safer approach than anti-NGF antibodies or TrkA inhibitors for the treatment of pain. At AlzeCure Pharma, we have synthesized very potent and selective TKA-NAM'S molecules. As can be seen in figure 1, AC27628 potently inhibits TrkA with an IC50 value of 2.5 picomolar, as demonstrated in the blue line. The inhibition of TrkB, as indicated in the red line, was 1.8 micromolar. This table summarizes IC50 values that we have obtained by comparing our TKA-NAM molecule 27628 to 2 other TKA-NAM compounds, one from Array Biopharma and one from Pfizer. As can be seen in the table, 27628 is more potent and more selective than both the Array Biopharma compound number 10 and Pfizer compound number 23. We investigated the selectivity towards BDNF-TrkB in more detail by using primary cortical neurons. BDNF induced a rapid phosphorylation of ERK, which was inhibited by a non-selective TrkA inhibitor, as shown in the red line. On the other hand, one of our TKA-NAM compounds did not inhibit BDNF-induced phosphorylation of ERK, as indicated in the blue line, thus suggesting that the selectivity profile of TKA-NAM compounds was good also in more complex cellular models. Next, we examined the efficacy of one TKA-NAM compound in 2 different animal models of pain. As can be seen in this figure, compound 27496 demonstrated significant analgesic effect in the CFA model of arthritis pain. The second model we tested was the axaliplatin-induced peripheral neuropathy model. Also in this model, compound 27496 demonstrated an analgesic effect in the same order of magnitude as duloxetine, the positive control. In summary, NGF and TrkA are involved in pain cessation and validated targets. Selective TKA-NAM'S might be a safer approach than anti-NGF antibodies or TrkA inhibitors. AlzeCure have identified potent, selective and in vivo active TKA-NAM molecules, and the preclinical characterization of these compounds is currently ongoing. You can find the contact information to AlzeCure Pharma on the poster. Thank you for listening.